here explains everything you ever want to know about the heart, all in one slide, right? So this slide, what do I mean by explains everything? Well, when you have a slide this big and this much material, it's really hard to decipher sometimes. So what do I mean that it explains everything? Well, it explains how your EKG relates to blood pressure changes in the heart. And blood pressure changes is a sign of the muscle contracting, right? The bigger the muscle contraction, the greater the pressure. So, shows us that the P wave stimulates the atria, right? So it explains how cardiac conduction, relates to the muscle contractions, which then relates to ejecting blood, which then relates to your heart sounds. So that's a lot of stuff in one slide, right? So let's break it down. And as we break this down, it should kind of make sense. Now, we have mentioned, right, that everything starts with a P wave. But what I don't like about this slide, and the only thing I don't like about it, is that they kind of ended it over here, and I wish they would have kind of ended it and kept going with a color scheme, right? So this kind of light brown color, right, and halfway through a P, well, that's this area right over here, right before we initiate another contraction. So we have just contracted, ejected blood out. Now we're relaxing. As we're relaxing, right, the pressure in the ventricle almost goes to zero. See that? On this chart right here, the black solid line is left ventricular pressure. And what happens? In this segment right here, the left ventricular pressure is very close to zero. So we're in an area we call diastole relaxation. So at diastole, the pressure in the left ventricle goes almost to zero. And what happens then? Nothing's contracting, right? The ventricles are relaxed, the atria are relaxed. The only thing that's happening in this phase right here, right, is a lot of blood comes from your body, the superior vena cava, inferior vena cava, and goes into the right atrium. At the same time, blood from the pulmonary arteries goes through the pulmonary veins and returns back to the left atrium. So at this point, right here, all we're having is the return of blood back to the heart, right? As blood returns back to the heart, it's going to go from the left atrium, and those mitral valves, tricuspid valve, everything's relaxed. So the valves are fully open, the mitral and the tricuspid. So as blood returns to the heart, it goes from the atria directly flowing into the ventricles. This is a period we call a period of passive ventricular filling. Everything's relaxed. The heart valves between the atria and the ventricles, the mitral and the tricuspid, they're also relaxed. So as everything's relaxed, the mitral and tricuspid are fully open. Blood going from the right atrium passively goes into the right ventricle. Blood going from the left atrium passively goes into the left ventricle. And it's all because of gravity, right? Because the ventricles are lower than the atria. So it's just passively filling the ventricles. So we're passively filling the ventricles. We should see our volume of blood increase. And that's what we see here, right? We are at, right, normally at the very end right here, we're at minus 55, right? Or 55 millimeters of milliliters of blood. And with passive filling, you can see the volume increase, right? That increase is passive. Nothing's contracting, everything's relaxed. And normally you go from I keep saying minus 55, you go from 55 milliliters till about 100 milliliters in passive filling, right? Now, when our heart rate is 60 beats per minute, that passive filling time is very long, really long, like 4 or 5/10 of a second, right? That's a long passive filling time. And when it's that long, passive filling accounts for about 80%, 80 to 85% of just flow into the left and right ventricles. then what happens, right? What happens now is we're going to start contracting the heart, right? With this contraction, it starts with the P wave. So, right, we hit the P wave, the SA note fires, which causes the P wave, right? And now as we have halfway through the P wave, we're going to look at the very start right here, right? Halfway through a P wave, what happens? The atrias contract, ejecting whatever blood is left over into the ventricles. And you top it up. You go from 100 to 125 in the ventricles. Now all the blood that can be in the ventricles is now in the ventricles, right? Now, what else do we see? Well, we should see the atrias contract, right? Because we're seeing blood moving from the left atrium to the left ventricle. So we should see the left atrium contract, and we should be able to measure it by the pressure change. And that's what we see here. Halfway through the P wave, in the dotted blue, that's your left atrial pressure. Take a look, it goes up, right? As it goes up, is a sign of the left atrium contracting. As it contracts, your left ventricle is receiving that blood under the same amount of pressure. So, slight increase in pressure here. Now what happens, right? The QRS complex, right? You depolarize the ventricular myocardium here, right? And again, this is where that slowdown is important. The slowdown allows you to contract the atrias, allow blood to go into the ventricles, and now the atrias relax. As it relaxes, then the AV node fires. As it fires, we see the QRS as the ventricular muscles depolarize. Halfway through the QRS, then we contract the ventricles, right? So as we contract the ventricles right here, we start going through a period of isovolumetric contraction, where we're contracting the ventricles, but there's no movement of blood. The sole purpose of isovolumetric contraction is to develop blood pressure. Remember, the aortic valve, the pulmonic valve, they have blood sitting on top of it, creating a pressure, sealing that valve. You need to pop them open by creating pressure from below. That's what's happening here in the dark blue. In the dark blue, you start contracting the ventricle. As you start contracting the ventricle, and that ventricle is full of blood at this point, right? All we're doing is creating tension. That's all, right? Now, to prevent backflow, what happens? Well, I'm contracting from the bottom. To prevent backflow, I need to close the mitral and the tricuspid valve, right? So as you contract, what happens? You close that, right, the mitral valve. Right now, you also at the same time close the tricuspid on the right side. But keep in mind, look at the pressure. This is only in the left ventricle, right? The right ventricle should see something, but it's much shorter. Instead of going to 120 in the right ventricle, it only goes about 20. So yes, right? We should see something similar, but much shorter in the right ventricle. So as both ventricles contract to prevent backflow, the AV valves, mitral on the left, tricuspid on the right, they close up. As they close up, blood hits it, and it starts having our first heart sound. Right here. Closure of the valves causes a heart sound. Boom, first heart sound. Right? Opening of the valve should never cause a heart sound. If there is a heart sound with opening of a valve, that's actually a bad sign. Right? You have some kind of valve issue at that point. Now, what happens then? The closure of the valve, the first heart sound, tells us that we are at the very start of systole, of ventricular contraction. Because the only reason why those valves closes is because you're contracting from below. As you contract from below, right, again, you have blood sitting on the aortic valve you have to overcome. So all we're doing here in the period of isovolumetric contraction is contracting to develop more and more pressure. As you develop more and more pressure, eventually the pressure in the left ventricle exceeds the pressure in the aortic valve. So now there's more pressure from below then on top of the aortic valve. What happens then? You physically pop open the aortic valve. And that's what we see right here. Right? You pop open the aortic valve, and then as you pop open the aortic valve, you start ejecting blood from the left ventricle to the aorta, right here. As you start ejecting blood from the left ventricle to the aorta, take a look at how high that pressure gets. 120, your systolic blood pressure, right? So as you eject blood from the left ventricle to the aorta, right, the blood that you eject from the left ventricle immediately goes to the aorta, so the pressure in the left ventricle and the aorta start to mirror each other. So here the pressure in the aorta is at 80. But now, as you start ejecting blood into the aorta is receiving that blood under the same pressure. So 120 right here, 120 for the aorta as well. So you keep ejecting blood and ejecting blood. As you eject blood from the left ventricle, the volume of blood in the left ventricle should decrease because you keep ejecting it into the aorta. How do we know this? Right here. As we eject blood, take a look at this, right? It starts going down. Why? Because you're ejecting it into the aorta. Now the crazy thing is this. Usually, we start off with something called our end diastolic volume. That's this right here. That's how much is the volume of blood before we contract. 120 to 125 mLs at rest. Normally, we just eject 70 mLs. That's it, right? So that area, that amount that we kind of eject is called our stroke volume. So your stroke volume is our ejected volume of blood with each cycle. If you think about it, right, you'll have about 50 to 55 mLs of blood left over that you then inject out, right? So at rest, your heart is pretty inefficient, isn't it? You're barely ejecting out greater than 50%. That's it, right? Now, it is greater than 50%, it's like 54%. But if you think about it, that's a pretty terrible efficiency. All you're doing is ejecting slightly more than half of what you started with, right? Well, we're gonna see, when we start working out, that actually starts becoming higher and higher. So as you work out, your, what we call our ejection fraction starts getting higher, all right? Now, ejection fraction is how much you ejected, stroke volume, divided by how much you started with, and diastolic volume. Your stroke volume, 70 mLs. Your diastolic volume, 120 mLs. So what do you get? About 54%. That's it. If you think about it, 54% is a terrible fraction, right? But the problem is, right, what happens when we go less than 50%? If we see somebody's ejection fraction less than 50%, that means that they ejected less than what came back, right? So you start off having more and more blood left over than you eject. Usually that's a sign that some part of your heart is starting to fail. Now, once we eject, right here, we see the T wave, which tells us that, right, some of the ventricular muscles halfway through are starting to relax. As the ventricular muscles relax, the pressure starts to drop. As the pressure starts to drop, you no longer have the driving force of blood going through the aorta, right? What happens? Well, the aorta is like a rubber band. The more you stretch it, the more it wants to snap back. So now you don't have that driving force of blood into the aorta because the left ventricle is starting to relax. Now the aorta wants to snap back. As it does so, now you have greater pressure in the aorta than in the left ventricle, right? As that happens, blood that you kind of pushed up starts to move back downwards, right? As it starts moving downwards, that occurs because of the elastic properties of the aorta, like a rubber band. The more you stretch it, the more it wants to snap back to its original size. And now, before, we have enough pressure kind of driving that blood out. But now there's not enough pressure in the left ventricle. What happens? That blood that wants to move back, now it starts to move back towards the heart. As the blood moves back towards the heart from the aorta, that blood then seals and closes the aortic valve. And again, as we seal the aortic valve right here, we should see or hear a heart sound. Closure of the valves causes heart sound. Here's the second heart sound. The first heart sound tells us we're starting systole. The second heart sound tells us we're starting diastole. All right? It's a sign that you're in diastole. As the aortic valve closes, at that point, no more blood movement, right? And what we're going to see here is a period of isovolumetric relaxation. Basically, the pressure in the ventricle starts to drop from 120 to 100. And now the aortic valve closes from 100 to 80 to 60 to 0. Right? As the pressure drops to near 0 right here, what happens? The atria receive blood from the body, from the lungs. Now the atria have more pressure on top, which causes the mitral and the tricuspid valve to open up. As they open up, now we have passive filling again, as we get ready for the next cycle, right here. Right? Again, all right, we'll go through this again when we come back from our little break, all right? But keep in mind, this is one cycle only. All right? Any questions?